Okay, so this is a technique called disruption of membrane technique. And like I showed you, here's the pelvis. We're going to put our fingers somewhere here, twist the skin the easy way, and then take the other hand and just squeeze your own fingers. And you're going to do it for 30 seconds to 3 minutes, here and here and here and here, here, all these different places. And it can restore, it can take away a lot of pain, and it can improve your mobility. So walk before and after, bend a little bit, see how you feel. So we'll go right on the center. Put your fingers. Press in, twist the skin, go the easy way. Take your other hand and squeeze your own fingers. And 3 minutes, 30 seconds to 3 minutes or more. You can do it as often as you want. You can do it longer. If there's a spot that hurts, you can do it in the spot. And then move the fingers over a little and twist and squeeze. Very powerful technique called disruption of membrane technique that Sharon Giammatteo developed many years ago. And she saw a thing in the medical literature called leaky gut syndrome and leaky vessel syndrome and cardiac ruptures. And so she's like, okay, there's these holes in the GI tract, there's holes in vessels, there's holes in hearts. These are all documented things in the medical scientific literature, and they call them different things: leaky gut, leaky vessel, cardiac rupture. And so she thought, how can we fix these up? And so she tried many different things, and this is the one she came with. Because you just put your fingers somewhere, twist the skin the easy way, squeeze your own fingers. And what she thinks we're doing, and the lining of all these things like organs and lining of arteries and veins and heart tissue, the lining is made out of phospholipids, and they're like little sort of like little magnets that are all lined up. And when you have a little hole, they're not really lined up, they're kind of like disrupted. And so what we think we're doing is we're lining up all these little phospholipids, these little magnets, so they can all be intact again. Bottom line is, if you do it over something that's got a little disruption in the membrane wall, you'll fix it up and you'll feel better. It'll be better. So we'll do one more right over the center. Twist the easy way. Squeeze. You can do it over the side. Twist the easy way. Squeeze. You can do all along the inguinal crease, the little crease for your hip. Twist the easy way, squeeze. And really, you would do it for longer on your own other hand, your side. Just twist and squeeze. You can do it anywhere. You can do it on the neck. Twist, squeeze. The other side of the neck. Twist, squeeze. You can do it right on the heart. Touch the heart, twist the easy way, squeeze your own fingers. I was doing this on one of my one-on-one clients who had been in a car wreck. And one of the things that happens in a big car wreck is you get little tears in the heart, in the aorta. Not enough to kill you, although that is one way that people do die in car wrecks. But low levels of that can cause neck pain, back pain. And whenever I would do this on his heart area, he just loved it. He's like, oh, that feels so good. Got eye problems, you could literally do it over your eyes, but do it gentle. Just barely touch the skin, barely twist the skin, and then barely squeeze your fingers. The other side, barely touch the skin, barely twist, barely squeeze your fingers. This technique should never really hurt, so don't do it if it hurts. You could do it on top of the head, twist and squeeze. You know, for eyes, you got the eyes, and then in the middle of the head is where the nerves cross. And then they go to the back of the head. So you can do it in the back of the head, twist and then squeeze. So do the base of the neck, twist and squeeze. And a disruption in the membrane wall integrity in the neck could improve how your hips move. It's like it's all connected. And then press, twist, and squeeze. If you have anxiety, this could help it, because it's like if you've got a little leakiness in your gut, a little leakiness in your vessels, a little disruption in your heart and your lungs, you don't feel so comfortable. It takes less stress to get you stressed. So you fix these up and you could feel even less stressed. Let's see, anywhere else, anywhere in your belly, like over your belly button. Twist the easy way and squeeze. For reflux, hiatal hernias, like all along here. Twist the easy way and squeeze. For reflux, this is a key spot, right where the ribs come up. Just press, twist, and squeeze. It's also the stress center of the body, so you'll feel less stressed. So let's just turn off this part of the recording for us, and we'll have a standalone video.